access to decent healthcare across the continent is something that is sorely lacking. Are schemes like the NHI something that we need to help drive healthcare forward in Africa?
I think the first step is just to clarify what NHI is. The NHI is effectively a universal access to healthcare. But as you would know, in South Africa, the public actually can access healthcare through the public sector. But we all know at ground level that there are some difficulties and complexities. The NHI as it stands today is an insurance fund where you can raise capital and invest in the healthcare system. And it is effectively a promise of universal access. So the desire to give every South African access to quality care when they need it at zero cost to the individual. So that is a noble objective. And the question is just, how do we sketch out the NHI to be able to achieve that objective? At this point, what we do have is the macro picture, but we haven't got the detail. So we do await a proposal from government, what we call a policy document on it, and after that we can have some consultative discussion, public consultations on the NHI. But there's a lot that we can do, even outside of NHI today. We don't need to wait for an NHI to come into effect to improve the access to healthcare. And if you will, I can actually expand on that. We don't have learnings on NHI in South Africa because we don't have the detail, but we do have learnings offshore. And to give you an example, in Brazil, where there is an NHI, 70% of hospital admissions in Brazil is through the private sector. So the government there and the private sector have found common ground in order to reach agreements on contracts in order to roll out healthcare. In other countries such as Chile, for example, NHI has resulted in an expansion of the private medical aid market. And the way it's done this is as you pay your payroll tax towards NHI, that fund actually follows you. So if you choose not to purchase the NHI from the government NHI fund, but let's just say from the Netcare medical aid NHI, you can take that fee with you and then you can just top up to get more comprehensive benefits. So there's not a one size that fits all across the different areas, but what you can see, it's not about private or public. It's actually about collaboration.
Well, let's go back a step and ask, is universal access to healthcare something that a government on its own can supply, or do you need the involvement of the private sector there?
It is all a function of the ability to fund it. So in emerging markets where you do have a smaller fiscus, you have a big population, it becomes more difficult. And hence you see the per capita expenditure on health in emerging markets significantly different to the more developed markets. You're often talking of 10% of that value. So we need to maximize the resource that we have. So you do need additional funding, but you also need to use all the resources you have because the demand for health continues to exceed the supply. So the desire is you should be using all the resources you have, both public and private.
Tell me how it works for Netcare in the United Kingdom, because you have a big operation in the UK. You're working very closely with the national health system over there. How has that worked for you?
Yeah, and that's actually a great example because it actually shows how simple the process can be. So at this stage, what we have there is it's a national health system, which is effectively the same thing as universal access. But any provider can offer services to the NHS. So in Netcare's UK business, for example, more than a quarter of our patients are public sector patients being paid for by the NHS. They're treated by the same doctors in the same facilities in the same manner. Absolutely no difference. The other ways that we can provide assistance is initially in the early 2000s, government came out with innovative ways to reduce their waiting lists in elective surgery. And Netcare tendered on quite a few of those contracts. And let me give you an example, mobile cataract surgery. So government put out a tender for cataracts. We agreed to do 35,000 cataracts over a period of 5 years. Then we had to think of, well, how do we do it in an efficient way to come in at government price and to achieve all the quality outcomes that were required? So we came up with an innovative model using mobile units to hit the countryside to get a broad reach of the nation. We looked at innovative ways in terms of process flow to ensure that there's an efficient in and out, there are no bottlenecks in the process. And we succeeded in achieving our objectives in terms of the number of people that we saw and the quality standards. And towards the end of the program, we were doing 22 cataracts a day, where the specialist eye hospital in the UK was doing 12. So I think we achieved our objective, and we showed that through innovation and collaboration, we could achieve something collectively.
Let's bring this back to collaboration in South Africa, or Southern Africa actually, because you also have a model in Lesotho that you've been following for a while now, public-private partnerships there. How has that worked, and is this something that you could replicate across Africa?
The topic is an important one because what we've done in South Africa, look, we can speak at length to all of the initiatives we have in terms of the engagements on the South African side. But in terms of the private-public partnerships in South Africa, they have been about the private sector coming in, building, operating, managing the facility, but not employing the doctor and not taking responsibility for the clinical outcome. In Lesotho, in collaboration with the government, we've been able to come up with an innovative model where Netcare, together with a whole lot of partners, is responsible for effectively looking after the health of a great portion of the Basotho people. So it's an 18-year contract where we will rebuild the tertiary facility and 3 of the primary clinics, which we call filter clinics. We will then be responsible for the health delivery, employing the doctors and the nurses and responsible for the quality outcomes. The intention there is to manage the life of the individual as opposed to just intervening at one point. So that's about integrated care. We will look from primary health care all the way through to the tertiary care side. It's innovative because it's the first time in the African continent that we've been able to look after clinical. And it's something that, if we get right, could create the new frontier of private-public partnership. And to give you an indication on that, there are a few metrics that we look at to see, is it possible that we can add value? So what we want to do is we want to ensure that there is an improvement in the health system in Lesotho, and we do that through improved outcomes. We've only had the primary care clinics open for 6 months. Very early stages, but the initial indication is that we've had 100% adherence in the prevention of mother-to-child HIV transmissions, and we've only done 400 births at this stage. The births that we've seen have not necessarily all been complicated, but we still haven't seen a maternal mortality, which is phenomenal in a country that has very high HIV prevalence and very high maternal mortality rates.
You're a listed company, you have shareholders, you have to make profits. Are PPPs profitable business for you? Is this business you'd like to pursue?
Stephen, at this stage, the build, operate and transfer model hasn't been a lucrative model. In fact, we've been investing in it. And we've been investing to see if we can take some learnings, but the aspiration is for it to be sustainable. It has to be a profitable model. We think that Lesotho gives us the opportunity to create the right balance to ensure sustainability.